In this video, we will cover the guidelines set out in the Ceredigion Medication Administration Scheme, which covers good practice in the administration of medication to clients. Sign the MAR chart immediately, but only if you see the service user taking the medication. When a client has medication more often than visits by carers, then medication can be left for them to take later. On the MAR chart, place FL for later. If on the next visit the medication has not been taken, then place in waste bottle and sign R for refused. If the medication is not present, then do not sign that it has been taken, as you do not know that for sure. Medication that is left to be taken later should be authorised by the care organisation and placed in a designated place. In care homes, do not leave any medication unattended. The complete process from administration to recording should only be carried out by one person. Do not dispense medication in advance just to save time during the busy periods like breakfast. All medication administered to the patient should be recorded. This includes all topical preparations. When administering topical preparations, first wash your hands and always wear gloves. This stops any active ingredients being absorbed into your body. All medications administered have to be recorded on the MAR chart. This includes tonics, inhalers, and creams. Only administer what is on the MAR chart. If not on the MAR chart, then do not administer it. This includes any bought over-the-counter medication. Follow the directions on the MAR chart, not what the patient says. Contact the pharmacy if necessary. If a client refuses their medication, remember to record it. You can use the coding system. Regular refusals need to be reported to the pharmacy or GP. You cannot force a client to take their medication. You are only there to assist the client in taking their medication. Do not crush or break any medication or disguise in food or drinks unless you have written permission from the GP and/or relatives. Otherwise, this will be seen as patient abuse. Don't administer medication that is not included in your training or you are not confident in administering, for example, injections. If you think you have made an error, don't panic. Phone the pharmacy and they can advise you. Most errors will not have a significant effect. If you suspect that the client has a side effect or a new condition, then contact the pharmacy or the GP surgery immediately. Do not administer any medication that has been altered by hand on the MAR chart, except alterations made by the GP. The GP has to sign and date the alteration. If you are not sure, contact the pharmacy. If there is a change in administration of the medication, then the care facility has to receive written confirmation as text, fax, or email before the first dose can be administered. Do not alter the administration dose by verbal communication, even if from the GP. Don't give advice regarding medication as it may be inaccurate and confuse the client. And do not share information about the client's medication with any other person, including relatives. Do not administer medication that you or a relative have bought the client to treat a minor condition, for example, cough medicine. Only administer what is on the MAR chart that has been prescribed to the client. Thank you for watching this video. Goodbye.